Шановні колеги, учасники засідання, щиро вітаємо всіх, хто вже
Colleagues, participants, hello. Hello, everyone who has joined our technical working group on mental health and psychosocial support meeting. We're still waiting for a few participants. So let me start from the introduction. I'm Yulia Okhmat. I'm the co-chair of the technical working group representing international medical course. And today we have, as always, Katarina Kryzik, the co-head of the technical working group representing the World Health Organization. Good to have you here, Katarina. And before we move on to the organizational points and the main part of our meeting, let me remind you that today is May the 8th. This is the Memory Day, the memory of the victory over Nazism in World War II. And here we stop for a moment to commemorate those who died and those who survived. This is the day when we say never again. And we mean it not only in the history context, but also in our day-to-day interaction with people, because it's all about respect, dialogue, and care about each other. This is the choice to benefit humanity and humanism. And going back to our meeting, let me say that today's format of the meeting will be the specific topic discussion. We have the leaders of different opinions and the representatives of international and Ukrainian professional societies, and some speakers will speak English, and also not all speakers speak Ukrainian. That's why let me remind you that you have the possibility to use interpretation. So on your Zoom panel, click on the globe icon and choose the necessary language channel. I can see that the participants already introduced themselves in the chat, so we kindly ask you to write your name, position, the organization you represent, and your contact information. That'll help us to get to know each other better and to improve our cooperation for the future. Also, we do not recommend to use the AI applications for the notes or protocols of the meetings, because we have the official protocol or minutes of the meeting, which we share together with the presentations and videos of the speakers, which we sent you after the event. Thank you. Yulia, sorry, I do not see the interpretation. So, below on the Zoom panel, if you don't see the globe icon, below to the right you have the 3 dots in a circle. Over there you can see more. So if you click on more, you will have some options and you will see the globe icon with interpretation. Yes, everything works well. I can see it. I can see 3 dots, but I cannot see the globe and interpretation.
Ще просто не почався переклад. Дякую. Якщо будуть питання,
so if you have any questions when our speakers present information, write them in the chat, not to interrupt the speakers. Thank you for asking your questions. So now I would like to encourage you to participate actively. After every speaker, you will have a chance to ask questions. Feel free to write them in the chat, or you can raise your virtual hand and say your question. So that's it about the organizational part. So with pleasure, I give the floor to Katarina for the opening of the main part of the meeting. Katarina, the floor is yours. Thank you, Yulia. Hello, colleagues. Hello, speakers. So we are so glad to have you in this meeting. Today we have a very important topic dedicated to disability, inclusion, and MHPSS. This topic is very relevant and it is highly important in humanitarian response and on the level of recovery. So technical working group prioritized this topic for this discussion because we know that in Ukraine people face disability. People with disabilities face a lot of different barriers related not only to the physical area of it, but we also have different other barriers like stigmatization, prejudice, bias, and other factors contributing to isolation. That's why we would like to actualize this topic. As you know, last year we had a training dedicated to the global guidelines on this topic, and today we will have this discussion where we will listen to different presentations from different stakeholders, and they will all share their knowledge about this topic. We have very saturated agenda, so without further ado, let's move on right away to the content of our meeting so that we would have enough time for Q&A. First, I'd like to give the floor to our first speaker, to Stephanie, who will share the current needs and the situation related to people with disabilities in Ukraine. Stephanie, the floor is yours. Thank you for being here with us.
Thank you so much, Katerina, and nice to meet you, Julia. It's a pleasure to meet you, and thank you very much for having me. Can everyone see the screen? I think yes, but just checking. Okay. I apologize that this presentation is in English. I will go through it so you won't miss anything. And I just, because again, I saw Larissa, I see League of the Strong, I also see Mental Health for You. So I just want to make sure I'm not speaking on behalf of Organization of Persons with Disabilities, right? I'm the disability advisor for WHO. Last year, I've been working in an interagency role. This year, I shifted more towards WHO, and together, and this is why I think it's an amazing opportunity, together with the Organization of Persons with Disabilities from all over Ukraine, including the government, we have been finalizing in February 2025 the situational analysis of the situation of persons with disabilities. I will drop the link to the source here. It is currently translated, so you will also receive the Ukrainian version. So without also further ado, so that we have more time for questions, next slide, please. Excellent. So I will just briefly summarize the key findings of the situation analysis. Be aware, this is a document with 105 pages going very deep into legislation, into barriers, into existing needs across a diverse group of persons with disabilities, from urban areas, from rural areas, from women's rights societies representing women with and girls with disabilities, towards people living with psychosocial disabilities, intellectual disabilities, as well as physical or sensory disabilities. So it's very important, and you are, of course, the experts here, to not unify this very diverse group. And as Katerina was saying, people with disabilities nevertheless do face specific barriers, and I'm using the term people with disabilities here in a very unifying way, but please be aware this is not what I intend, because people do have intersecting discrimination. You can be an older person with disability. I'm just here in Venezia having met people with Down syndrome, for example, or people with intellectual disability I'm going to meet once I drop off this call. So people face different lived experience and different barriers, okay? So just to put that out here, it's a diverse group, is represented by a diverse community, but of course, in order to give it a bit of a more flow, I will try to focus on people with disabilities as a word, and of course, for this technical working group, I am focusing on barriers to mental health services, as well as barriers for people with intellectual and psychosocial disabilities. I will then very briefly just go to coordination and potential next steps of what we as community and the humanitarian sphere could, it's not a should, but could do next. So here you see the link also to the disability or to the situation analysis for persons with disabilities in Ukraine. Again, I dropped the link down below, but you obviously see NAPD as umbrella organization, UTOC, UTOS, hearing impairment and visual impairment, as well as League of the Strong and Fight for Right, in addition to coalition and others, as well as the government. Next slide. Thank you. So on the one side, again, just to set the scene, the United Nations Convention on the Rights of Persons with Disabilities has been ratified in Ukraine 2009. So really, Ukraine is committed to implement disability rights since that time. Of course, the ongoing war, and you all know that, has exacerbated barriers for persons with disabilities, in addition to leading to more trauma, injuries, and in the end, persons with disabilities living in the country. Again, as I said, the focus area of today's meeting is really mental health, healthcare access, and challenges for people with intellectual and psychosocial disabilities. This is not to exclude others or other barriers. There are a variety of barriers for education, employment, etc. It's just 15 minutes. I didn't want to overdo it. So if you take a look on the left side, there are overall barriers to mental health. And again, you are the expert, so I really hope I imagine I'm not telling you anything new. If you have questions, as Julia said, drop them in the chat. Again, as you know, there's huge stigma in regards to a person or just accessing mental health services. I imagine that there is obviously not obviously, but based on the information we had in the study, is also different between men and women due to different roles, due to different experience, due to different expectations within society for men and women. It is different for men with disabilities or women with disabilities, so overall to access mental health services. We have, of course, an access issue. Again, you're the experts. We have limited availability of community-based mental health services. Again, am just in Venezia understanding or trying to understand community-based services. And people really report there is a lack of access. And of course, we also have overwhelmed rehabilitation teams due to war-related trauma and the pure amount of people in need of rehabilitation service. We have multidisciplinary teams in inpatient departments, but not at community level. There is, of course, also, despite the overwhelming, a lack of workforce and trained workforce. We have, and again, nothing new, infrastructural damage. And when we look into psychosocial support, there are insufficient programs for war-related trauma and PTSD. I think one area that it's not necessarily related to mental health, or maybe it is, but if you look into gender-based violence or violence at home, right, for people coming back or returning from the front line, this could be, of course, interlinked. When we then look into overall barriers to healthcare, right, so mental health is a part of that. We really need to pay attention to physical accessibility is always the key area that people look for. So I, of course, also put it here. Many healthcare facilities like ramps, elevators, and accessible equipments. One area really for women and girls that are wheelchair users are accessible gynecological chairs. Apologies. We have a lack of sign language interpretation. I was just, for example, together with UTOC, the National Society for People with Hearing Impairment. And of course, it's not to say that people with disabilities only need healthcare. Of course not. But among services they do need, this may be healthcare. And this can be from the dentist to mental health support to any other. We do have an issue when we talk about sign language interpretation, as well as the availability of personal assistance available at healthcare facilities that do support and guide people through the facility in case of need. There is a shortage of assistive technology, and there are, at least depending where you are and in which area of Ukraine, And not talking, of course, about the rehabilitation unit that's called, I think, Heroes. They have super cool and super fancy equipment, but not everyone has that, and not everyone has access to this. So there is partly a shortage and outdated rehabilitation methods. And again, we really look into the community level, right? When we talk about universal healthcare access, where are the people and where are the services, right? And here it becomes very tricky. And then, of course, we have a whole displacement. As you know, IDPs do face different or difficulties accessing healthcare. And one area this may not be considered important for us, but there is a lack of trust into the new family doctor, right? So people have been used with their family doctors. They know the whole history. And people with disabilities have reported that that there's a lack of trust into the new doctor. Again, these are reported experience. We don't want to generalize. And they are also marked as such in the situational analysis where people share their own lived experience. So that's not an overall generalization, right? Or not representative. Next slide. If we now really look into barriers for people with intellectual and psychosocial disabilities, again, there is a high rate of institutionalization, first of all, among the group of people with intellectual and psychosocial disabilities, but also now due to the war. There's a higher institutionalization of older persons, people with disabilities who've lived independently before the war and are now displaced. But also there's a higher risk of institutionalization of children or people with disabilities where the caretaker or the parent is of older age or has died because there are no other services on where and how to place them. This is not to say that everyone does need support or care, but it is to say that the community services and specific services that people may need in order to live an independent life are barely available. Right. And when we take a look into institutional care facilities, they are unsafe. There is reported violence and human rights abuses within those institutions. Even worse, because now they're overcrowded and people living in institutional care facilities, for example, in the East, have been evacuated to institutional care facilities in the West. Not all, some also outside of Ukraine, right? But again, this is an issue. And then there is a legal capacity restriction. So we have around, and the situation analysis goes in depth around into this. There's 35,000 individuals deprived of legal capacity, limiting their rights to self-determine. So this is, again, really a key issue for people with intellectual and psychosocial disabilities, not only, but a key issue for them, or as they reported. And this is very challenging. We really do need a legal review. We need adaptation of the legislation in order to support them to really be more self-determined, right? And to provide information in a way they also can be self-determined. This is very interesting. This is also an important issue when we talk about, and we all in our organizations do that, information. Are we supporting people to actually give consent in the way that they understand where they're consenting to? We know some health facilities may be overcrowded. Some mental health professionals may have, a lot of patients or a lot of clients, and they may not necessarily take the time to explain it in a way that it needs to be explained or easy to understand language, etc. So information, accessible information, of course, is a key. And then last but not least, and this is not the whole comprehensive view, of course, there is social exclusion. So if we talk about like provision of psychosocial services at community level, of course, that's one side. But there is social exclusion when we talk about, and we see limited access to education, employment, and social services, even if the social services are there and available, which is not everywhere the case. And if then not everything is offered that is part of basic social service provision in Ukraine. And but we do see a specific discrimination, or an increased discrimination, let's say, of persons with intellectual and psychosocial disability. And again, stigma and discrimination really further marginalizes these groups. Again, I imagine for you specialists working in the area, this is nothing new, but I just wanted to share that. Next slide. And here, when we now look into recommendations, they have been worked on with the government, with OPDs together, and try to bring this together. And it gives a pathway, right? So mental health, again, we really need to expand community-based healthcare services and need to train healthcare professionals on inclusive practices. For everyone working beyond humanitarian, the Barrier-Free Council, the action plan for 2025 and 2026 is including such actions. So train healthcare workers on inclusive communication and inclusive health, right? Because it's not just the provision of a service, it's also the inclusive provision of such a service, where the facility is accessible, the staff is trained, including non-health staff, right? Also, the receptionists, if they are not a medical professional, or we have accessible toilets, etc., and guidance and support, again, where needed. When we talk about healthcare and the provision of services at healthcare level, we need to really ensure that the healthcare facility and services, this is connected to the first point, are accessible, not just physically accessible. Yes, Barrier-Free Council at local level as well as national level work on accessibility. And I've just seen a very interesting example of Venezia City. So a lot of primary healthcare units have been or are about to be renovated. And you find accessible toilets, ramps, and markings for people with visual impairment, right? So this is a very important step. But when I was saying, well, what about people with speech impairment? How do you do that? Or people who need sign language interpretation, or people who may need a personal assistant? Then we struggled a bit to find solution because that's not always there. So we need to think it a bit more comprehensively. And I guess there are innovative technologies around, like, how's it called? Telemedicine, for example, so that the person can use the mobile phone, right? And then, of course, we need to increase the availability of assistive technology and specialized equipment, ideally on an individual basis, right? Not an overall availability and a stock of unified crutches and wheelchairs, because we all are different. We all have different bodies. And when we talk about intellectual and psychosocial disabilities, we really, whatever we do, need to promote deinstitutionalization. This is particularly important, and I can't stress this enough, for humanitarian actors. Ukraine wants to join the EU, and within this EU accession process, Ukraine has signed up within 10 years to deinstitutionalize. So also we as humanitarian actors need to contribute. And this can look very different, right? This can be the provision of community services. This can be training on inclusive practices for primary healthcare facilities. This can be collaboration with OPDs, with civil society, in order to enhance awareness at community level. Whatever you can think of, and this is also leading towards the last point, right? That we need to collaborate. We need to ensure that the people we are talking about, people with psychosocial disabilities, people with intellectual disabilities, are part of processes, are part of decisions. So we need to make sure that we support, if there's opportunities, and I know the situation currently in the world looks very dire, but if there are opportunities, that we support OPDs, that we partner with OPDs, that we develop capacities where needed, include them in trainings even, right? So maybe a person with intellectual disability, if you do a training to service providers, maybe they can join and do the inclusive communication bit, right? So there are various ways, including going to schools, etc., and join that. So being mindful of the time, next slide, please. And I just want to very, very briefly look into the coordination. So some things that have happened last year and hopefully will continue 2025 and beyond. If we are looking into OPD participation and really trying to get the people who are experts on the table and around the table, this is what has been done last year. So we supported the setup of the Age and Disability Technical Working Group core team, which is hosting the newly trained disability focal points. So if you have a question in the health cluster, which you are under, there are trained disability focal points. I do see, again, we see Larissa here from OPDs and colleagues from League of the Strong. So make sure to include them into strategy development, information sharing, etc., and even partnership. We've trained a lot of cluster partners and NGO platform members, did joint cluster missions and guidance preparation, always in collaboration with organization of persons with disabilities. Every training, every guidance I shared and said, okay, is this, going into the right direction? Or if you have, for example, round tables in an area, right? And you invite the government, right, or the Ministry of Health or Department of Health, you could invite OPDs, right? And you could moderate a round table, for example. Next slide. One other area, and I don't want to go in depth here, but it is very important that whatever we do collect data. We do collect data about persons with disabilities and report back. So it's very important to not only focus on the people for our services, right, and humanitarian that are certified in Ukraine. Because we can imagine and assume that the people with disabilities in Ukraine are currently more than the identified 9%. So to use the washing group questions, also to use the extended set of the washing group questions when we talk about mental health, depression, etc., this could be a good effort, especially for service provision and the humanitarian. I'm aware that they then are not obviously, they can't access social services or benefits from the government, right? But this is also not our role in the humanitarian sector. So to really make sure we identify everyone in need, I would highly and strongly suggest to go beyond the certificate. And then next point, and again, I don't want to go in depth, but I think the achievements can just show how important coordination and collaboration is. So you do collect the data, you work with the experts, you at least from time to time ensure that awareness raising trainings is done together with persons with disabilities, together with OPDs, that is leading to an increased understanding, right? If you do something, and especially mental health, I imagine, is affecting a lot of people, right? So in the same way that you mainstream disability, we may want to mainstream mental health. So having joint missions, having joint missions, have really moving into collaboration, always bringing in the respective rights-based organizations. I've been working, for example, with Coalition, representing advocates for people with intellectual disability. And I'm always happy to connect you, right? But again, you already have experts in the technical working group as well. And when we are working with organizations of persons with disability, one area is really we need to not just work with them, we also need to support them funding-wise. This is important. Like for everyone else, right? We need the amazing staff to continue doing what they do. And even among UHF processes, we may be willing to partner with OPDs to say, hey, look, we provide mental health training, I don't know, for social workers or anything for that matter, but we do want to include a small awareness raising campaign, or we do want to, ensure that with the unit we are working with or the community level authorities, everything they produce is available and easy to read, right? So we support and partner with the respective OPD to have a joint approach, right? And especially we are talking about, unfortunately, a decrease in funds. So collaboration and coordination, that we really avoid duplication and that we support where the government of Ukraine is going to. Also, yes, recognizing we are humanitarian actors, but we want to support, right? And we don't want to create double solutions or duplicate any effort. Next slide. And I think I already, and I'm very sorry, once I get started talking, it's hard for me to stop, but maybe we switch to the next slide so that you guys also have time to ask questions. Thank you very much. And apologies to the translator for my speed.
Дякую дуже, Стефані. Якщо
Thank
можна,
you, Stephanie.
зі свого боку
If I may, from my side, I would like to take advantage of moderating this meeting and ask you a question, because I know that a lot of colleagues are here with us and participants probably know you personally and they have your contact information. But here is my question. What can we do as organizations, stakeholders in response, in the context that we can see the reduced financial resources, reduced resources in general. So what can we do? Taking into account that needs of persons with disabilities are often ignored or like pushed down in the priority list. So what can we do to make sure it doesn't happen?
I think one area, and thank you, Katerina, for the question. I think one area, and of course, that needs staff, but considering and hoping people stay and there is staff available, I think one area really is advocacy, like raising awareness and making sure that also within humanitarian, right, we do collaborate with DOH, for example, right, and constantly raise it. I do, for example, hear from time to time that in general coordination meetings at different oblast levels, how can I say, some ministries of social policy representatives are actually, because institutional care, as everyone knows, I imagine, are under the MHPSS, are always, not always, but are kind, due to the lack of alternatives, let's put it very carefully, are a bit not so much against institutional care facilities. Let's put it very careful to not make it, but to when you meet them and when you hear those things, raise awareness, right, everywhere you go. And I think, and include, and this is a small amount, I'm not talking, for example, about a national-wide awareness raising campaign, but I do know the Ministry of Social Policy is, for example, working with different agencies together and OPDs together to do awareness raising for specific groups. And this is also part of the Barrier-Free Council action plan, which I know in humanitarian we may not use, but right, but it's a government instrument, so to say. So really, as INGOs, for example, to really stronger, if not yet done, connect to the government where we are operating in or to authorities, right, and connect to what's there. I just, for example, also learned how vast the civil society is in Venezia, right? So to just do the mapping, like do what we do, but just do it a little bit better, understand who's who, understand legislation, and connect the dots. That's sometimes even enough. So we don't have to change a lot. We don't have to invest a lot. Just do what we do in a coordinated, cooperated approach. That may take a month longer, but go there, talk to the people, understand the barriers, and maybe just minimize one barrier instead of 100, right? And do this in collaboration with the Department of Health or NHSU, depending where you are, right? And really just having this overall understanding. We are all human beings, right? So we may need healthcare, but we also want to go to a concert and we want to be independent and take the bus to the concert if we can, right? So just imagine, well, that person or that thing that we are doing is one piece in the puzzle of life, right? So to connect to others, to ensure referral potentially, right? Because I imagine all the organizations here offer more than one service, right? But nobody knows all. So to know, okay, HI is doing this, and Medical Dumont is doing this, and WHO is doing this. Why not connect and refer the people among our services? I think that's, and bringing mental health to the community. And I think a lot of you are already doing this, right? There is, and you guys know that way better, but wherever we can do at community level, right? And try also to ensure that this is taken over by the government at one point and included into social services, etc. I think these are the key points that wouldn't necessarily make it more expensive, I think.
Дякую дуже, Стефані.
Thank you so much, Stephanie. Yes, actually, thank you for sharing such informative and information, and that, like, following this approach, which is very sensitive to all the organizations and all the efforts which are being put to practice. So that is a big part of your presentation. Thank you so much for that. Thank you so much for joining us and taking your time, despite the fact that you have so many meetings and visits as we see it. So thank you. It's so appreciated. And we will share with you all the other questions if we have them. Thank you.
Yes, perfect. Thank you so much.
Зараз я хотіла би рухатися
So now let's move on following our agenda, and we will move on to the speech of Svetlana Gnatyuk. She's an expert of barrier-free NGO, and she also represents the Coordination Center for Mental Health of the Cabinet of Ministers of Ukraine. Svetlana, I know you have a lot of different meetings, but thank you so much for taking your time to be here with us. So we'd like to hear about the accessibility of services from the perspective of the Coordination Center and what's been already done. Svetlana, the floor is yours. Hello, can you hear me well? Yes, we can hear you well, we can see you well. As it's been said, I'm Svetlana Gnatyuk, and today I will speak about the tools which will make it possible to ensure accessibility for mental health services for low mobility groups. We don't want to focus only on people with disabilities. We want to speak about broader audience because all of us understand that in different times of our lives, we can be in low mobility group and require different types of support. So let's move on to the tools themselves, which can ensure physical accessibility for people with disabilities and other representatives of low mobility groups to the mental health services. First of all, it's the rehabilitation modules. It's the service on physical and psychological rehabilitation available on the outpatient level and in the community where the person lives. Such module is like a house, not big. It is constructed by module technology. It is fully barrier-free and has a lot of different rehabilitation equipment. The benefits of this space is high technologies, low costs for production, and the potential for scalability. The module has multidisciplinary team, including case manager, physio-rehabilitation masseur, psychologist, speech therapist, and other specialists which join the team if needed. And the main factors or services: physical rehabilitation, occupational therapy, prosthetics, speech therapy, and psychological service and supervisions for specialists is available both online and offline. That enables strengthening the accessibility of the services. And for that, every single module has necessary equipment and software. And right now, we have 5 modules like that in 4 regions of Ukraine: Ovruch, Vasilkiv, Obuchiv, Kropivnitsky, Khotin, and Slavutich. The project is being realized within All Ukrainian Mental Health Project How Are You, initiated by the First Lady of Ukraine, Olena Zelenska, and the Coordination Center for Mental Health, Barrier-Free NGO, and other businesses, barrier-free businesses participate in that. The second tool, which makes it possible to ensure physical accessibility for the mental health services, is mental health centers. This network is the part of the priority project of Ministry of Health within All Ukrainian Mental Health Program How Are You? The main aim of the activity of such centers is to ensure high quality comprehensive care for people with mental health disorders on the outpatient level and where the person lives. And approaching this network, we also put into it the components of barrier-free and accessibility. Here you can see the QR code to download the guideline on how to equip mental health center, including all the accessibility and barrier-free principles. Now let's move on to the tools in which ensure information accessibility to mental health services for a broader audience. One of these tools is the How Are You platform, which has all the practical tools to take care of your mental health and to cultivate your resilience. The How Are You platform is created with the support of Ukrainians, and it helps Ukrainians overcome the tough times and to foster the culture of mental health. Here you can see all the necessary products which make it possible to check different self-help techniques, and like this platform has tips from psychologists to build your own resilience. The next tool is Momental application. It also has been created to improve mental health of adults and children. It has 365 practices to reduce anxiety, stabilize emotional condition, and develop attention. The author of the copyrights is Svetlana Royce, the child and family psychologist, and this application has free of charge information. It is free of charge, and That's why this service is accessible. Also, would like to speak about the guidebook, barrier-free guidebook. It is the guidebook for communication and interaction. It also has the part of ethics in the stress period, and here you can see how to take care of yourself and those around you, and it is very accessible because like all the website and the guidebook itself is accessible for all the people, and it is accessible both in like offline format and with the special tools. Thank you. Thank you so much, Svetlana. Colleagues, questions? Maybe you have some questions to Svetlana. Yes, a quick question. Sorry, I couldn't raise my hand. Hello, Svetlana, could you please tell us? Right now, we have a lot of different institutions due to the last mainstream of different organizations to the institutions stopped letting in the NGOs to check whether human rights are protected. All the institutions are under the regional councils, and the city council cannot impact that. So how can we maybe sign the memorandums or agreements so that more institutions would be able to welcome us and provide care to those people who need care in the institutions? Thank you for your question, but I would like to say that this question for sure is not in my area of expertise. I cannot answer it, but that such cooperation for sure is there. Maybe it's some cases just in your area of work, but I cannot answer this question. Thank you. Because actually, most facilities, they let in different organizations to make sure that the human rights are complied with, but like some institutions do not open their doors to organizations. So thank you, Anna, for your question. Thank you, Svetlana, for commenting. As a technical working group, we will note it. And since we stay in touch with Anna and colleagues, will try to dive deep into it, clarify the situation, and answer it bilaterally. So thank you for the presentation. Let's move on. Following our agenda to the global picture, you know, to zoom in the area of inclusion, disability, and psychosocial support. Nina asked a question in the chat. All the presentations will be sent to you after the meeting together with the recording. After we dive deep in the Ukrainian context, let's move on to the presentation on the global recommendation note that we have on disability and inclusion. And right after that, we will move on to discuss the activity and successful practices of different organizations working in Ukraine, representing this activity in the area of disability and inclusion. Heather Pearson, the floor is yours. Heather is our expert on disability and inclusion on the level of our international reference group on MHPSS. Heather, the floor is yours. Let me share your presentation.
Thank you, Katerina. Hello, everybody. For many of you, I've met you once before online over the last couple of years, and I'm really happy to be back to speak to you about this important tool. So I am a consultant with the mental health unit in Geneva with WHO based in the UK. And today I'm going to talk about the IASC information note on disability and inclusion in MHPSS. Next slide, please. So before we really talk about the tool, it's important to talk about a couple of definitions which would help us understand why this tool is so important. Stephanie has already gone into detail about the situation in Ukraine for people with disabilities. And I want to just clarify what a disability is. The definition for disability is the interaction between a person's impairment with the barriers in the world around them. So when we talk about an impairment, It might affect a person in how they move, how they behave, how they learn, how they take in and interpret information, but that itself is not a disability. The impairment becomes a disability when they face a barrier. So Stephanie referred to a few things that occurs in the UK, or sorry, in Ukraine, talking about stigma or physical buildings, talking about access to communication and understanding information that's being shared. Those are the barriers that people with disabilities face. Next slide, please. But why does that matter so much in emergency settings? And why do we want to focus on disability inclusion? We know that in emergency settings, people with disabilities are more affected and they face more barriers. If you look at this picture on the side of my slide of a train station and people fleeing a conflict setting, you can imagine what it's like to be in a wheelchair and trying to navigate that train station, or what it's like to have a visual impairment, to not be able to read the signs that tell you where to go. Maybe you have anxiety, and being in this crowded space is not a comfortable thing to do at all. So these are some of the barriers that we have to start thinking about. The result is that people with disabilities have less access to services and they participate less in emergency responses. So next slide, please. So this is the IASC information note on disability and inclusion in MHPSS. It is available in the Ukrainian language, and I'll be sure to share that link at the end of my presentation. But if you take one message away from this document, it is that if you want to have a program or response for MHPSS to be effective and responsive to the needs of people with disabilities, you have to do two things. One is address barriers to access, and two, be informed by the participation of persons with disabilities. Next slide, please. So the information note was developed in a really unique way. It took place over many years, and a series of workshops took place with organizations of persons with disabilities, or OPDs, because we knew that it was important to include the voice of people with disabilities. And then we went on to develop a training package. So some of you already participated in this training last year. But again, what was really unique to this training is that it is meant to be co-delivered by disability and MHPSS actors. So if you were at the training in Kyiv, you might remember that Alexia was there alongside Ben facilitating the training. So this is a really important part, because to share information, it's important that it comes from people with disabilities themselves. Next slide, please. So the content of the information is quite vast. It goes into the challenges faced by people with disabilities, what an inclusive response looks like, how to remove barriers, and then a whole list of recommended resources. Can you just click one more time, Katerina? So I'm going to do some cheating for you and provide you with what you really need to look at. If you have enough time to read the whole document, then please do. But if you don't, I encourage you to look at section 4. In this section, there is a table called Table 3. Click again, please, Katerina. Thank you. And it highlights 5 different aspects of an MHPSS program where barriers can be removed. So it goes into environments and buildings, the equipment that might be used, how communication is done, activities and services and programs. And it really gives you an easy to read, concrete list of how to remove barriers. So if you don't have much time, this is a really great resource to have on your desk when you're designing MHPSS programs, so that you can think of the key things that need to happen in order to make sure it's inclusive. Next slide, please. The document has 5 key messages. And again, I'm going to be helpful by just highlighting them to you and allowing you to keep them in your back pocket for next time you want to improve inclusion in MHPSS. The first one we've spoken already about today is the importance of consulting with and ensuring the meaningful participation of disability actors. That means that their participation has to be of some worth. It's not just a box ticking exercise, actually including the voices of people with disabilities, and even taking it one step further to employ them or bring them on as volunteers so that they are part of the program, not just receiving services, but offering services. It's important to ensure the capacity of staff and volunteers, to identify and remove barriers, which I've already referred to, table 3, that's your master list. Advocating that data collection systems are disaggregated so that data systems are keeping track of how many people in the community have disabilities, what their gender is, what is the age of people, so that you really begin to understand the community around you. And then last but not least, leaving nobody behind. Oftentimes in emergency settings, we forget people who are in long-term care facilities, such as psychiatric hospitals. We forget to make sure they have their basic needs met, and we forget about them during evacuations. Next slide, please. I wanted to just highlight how we've incorporated disability inclusion into an MHPSS resource, which is available to you. So some of you may have seen this already, but My Hero Is You is a series of books. It originally was an IASC reference group product, and now WHO collaborates with UNICEF on it. And it's basically a storybook that supports children during challenging times. We started during COVID with 2 books, and then we developed a book for conflict settings, and then finally a book for children who are affected by MPOX. Next slide, please. So how did we promote disability inclusion through these books? First of all, 2 of the characters that we've had in the books have disabilities that we know of. So oftentimes disabilities are hidden, but you can see visually on the top picture, there's a boy who has a wheelchair, and then on the bottom picture, there's a boy who has albinism. So we included them as characters, but then we went on to also interview people with disabilities to get their feedback on the books themselves to make sure that the information we were providing was accurate. Some of the books have been translated into Braille as well as easy read. Next slide, please. I'm going to challenge you to think of other ways to make this resource inclusive. So I know that this book is currently undergoing a couple of modifications. It's being translated into Ukrainian, and it will be available for you to use. So I'd encourage you to think about the other aspects of disability inclusion. Think about how to ensure staff and volunteers who are using it are including children with disabilities when they read the book to communities. How do you navigate collecting information, M&E, and data to make sure that you're disaggregating according to children with disabilities? And finally, how do you leave nobody behind, even with a resource like this? Next slide, please. Thank you for giving me the platform today, and do keep in touch. If you have any questions, please do not hesitate to send me an email. And thanks again for letting me join today.
Дякуємо дуже, Хезер.
Thank you so
І
much, Heather.
хотіла би
It's true.
відзначити і подякувати
I would like to
імені технічної робочої групи за
say thank you on behalf of the technical working group for your speech and for the tool itself, for this recommendation note, and for the training which you helped us organize. So that training had a lot of positive feedback, and right now we are also thinking about how to continue deploying it in Ukraine. Also, I have a question. Very often when we speak about questions or point of inclusion, accessibility, disability, there is the question of the price of all these points and the price of implementation of all of that. So there is this picture that like it has to be done by some only big organizations with big resources and big number of staff. So since it's believed that the implementation of such accessible services is more expensive and requires more staff, and actually sometimes can be, delayed or procrastinated or pushed down in the priority list. So taking into account that this recommendation note was developed, taking into account the global practices, and we know that in many countries with emergencies, there are different resources, there are different numbers of organizations working, and what can you answer to these questions about the price and whether all of us have to pay attention to the accessibility of our services, or is it just the function that has to be done by bigger organizations, NGOs, and so on? I don't know whether you understand my question with the interpretation, but I hope you do.
Yes, thank you, Katerina. That's an excellent question. I'd like to highlight one of the messages in the information note is around this idea of building back better. And so in emergency settings, oftentimes there is money that comes in for services such as mental health services. And this is the opportunity to rebuild a country in a way that is inclusive. So I think there is opportunity after an emergency and during an emergency to actually integrate these things when resources are available. But also many of these things are not expensive. Even today I was costing how much it would cost for something to be printed in Braille versus easy read. So easy read is when language has been broken down into a simplified terms for intellectual disabilities. And that does cost money, but there's ways to get around it. So for example, maybe instead of using Braille, you use audio and you record a message. Or maybe you use images instead of the cost that's invested in easy read. So I think that sometimes we get distracted by the big shiny things, and actually there's simple ways to integrate inclusion in a cost accessible way. And I really think now is the time to start thinking about it so that when Ukraine is rebuilding itself, it can do so in an accessible way.
Дякую дуже, Хезер.
Thank you so much, Heather. I absolutely agree with you on that. That's exactly why we're organizing this meeting today, to once again bring up this point, make it relevant, highlight all the points that need to be paid attention to, so that all the service providers would understand that they can impact and they can be engaged no matter how big their resources are in a meaningful way. So are there any questions to Heather, or do we move on to the next speaker? I don't see any other questions. But probably it means that everything is clear and we can move on in our agenda. Thank you so much, Heather, for taking your time to join us. Thank you so much that you continue supporting Ukraine and joining our meetings to share interesting materials developed on the global level, which are really relevant for us as well. So now let's move on to our next speakers. And very important speech goes next, since the National Assembly of People with Disabilities has joined us. This is the organization that's one of the leading organizations in Ukraine in this topic. The efforts of this organization were so meaningful and important even before the full-scale invasion, and they continue being impactful right now. We know that your organization implements a lot of projects. There is a lot of advocacy and cooperation with different stakeholders that we have today. So it's about the assembly of persons with disabilities. So if we speak about it in detail, it may take way longer than the whole meeting today. But anyway, we are so thankful that Larissa Baida is here with us today to share the needs of persons with disabilities in Ukraine and about the projects on mental health in the specific regions of Ukraine. Larissa, thank you so much for joining us. Thank you, Katarina, for such great introduction. Let me introduce ourselves once again. For those who don't know us, we're the umbrella organization for more than 100 organizations created and managed by persons with disabilities. So previous speakers, they spoke about that target audience. That's us. We are the service users in the health area. I will quickly share this information because most of the slides you have on the website, both in English and Ukrainian. And I have a few comments about previous speeches. I was quiet because I thought that maybe it's not okay to say too much. So I want to say that part of our work is our work can be divided into advocacy direction, including MHPSS. We work a lot on legislative regulatory documents in health sector. It's also about trainings and leadership strengthening of OPDs, of different specialists in the health sector. I will speak about that. And we also work in the direction of service provision. We work with the institutions that were mentioned today. And a short comment, this is a very, very difficult question. I was listening attentively and couldn't really understand who we talk about. MHPSS is a very, very important topic. Who we provide the services to, how the services are provided, and who provides the services. So hear me out. Yesterday, out of the official information of the Ministry of Social Policy, I want to give you just one number. According to the National Budget Program for the community services, more than 1 billion hryvnias was allocated in 2024. 260 million hryvnias was used out of 1 billion. And it's about the services and about the development of the services in the communities that we're talking about. We can speak about the sustainability of humanitarian aid, which the organizations provide. But everything else that you asked about, Katarina, it's the responsibility of our state before its citizens, including persons with disabilities, to fulfill the international responsibilities in human rights protection, including mental health area. We signed resolutions, declarations, international pacts. All we need to do is fulfill what's said in these documents, and the fact that this system doesn't work in Ukraine is clear. We contribute a lot. We created the centers, humanitarian organizations work, but probably something is missing. We can dive deep into it later if we have time. Let me share just one example. As users, what is it that we face? From one of the projects, we have a lot of different projects like that, and I said that we are a very specific organization. We have the psychiatric care users, and they provide support to us. A lot of organizations working with youth and children, so we work with different people. And one of the examples of the projects which was implemented in Volynska, Chernivtska regions and Poltavska region or oblast. So with the example of this project, we will share our results. Maybe it'll be interesting. I'll be quick. Next slide, please. So within the project, classically, we made the mapping. We looked at the available health packages and hospitals in the communities. We looked at funding that's available, and here we put the trainings for the specialists, health specialists, doctors, health workers, all of them got the WHO certificates. After they finished the trainings, we conducted the awareness-raising campaigns and advocacy campaigns. So why mapping was important, you can read all of that in the methodological recommendations you will see below. But we understood that, for example, let's take a community. A community may consist of 25 or 30 villages, and all these villages have one hospital, and the access to mental health services, even in the primary health care package, I mean, from the family doctors, the access to the services is very weak, and it's impossible to cover all the population of all these villages in the community. Basically, when we looked at the health facilities, we understood that like health workers need support since they need to freshen up their knowledge. And we looked and saw that most communities receive the services only on the primary health care level. So it's also important to change something so that the community would provide the secondary level services and get the funding from the state. Unfortunately, within the project, we failed to increase the capacity of health facilities due to the fact that there is no municipal transport, like it's absent, and to like 50 kilometers to get to the hospital, that's way too far for the patients or clients who need the services and care. Most MHPSS services are provided in the oblast regional hospitals, and the person cannot even get to these hospitals. Our target group, people who use psychiatric care all the time, as of today, they do not have the access to all these services we're talking about today, and the number of mental health professionals has significantly reduced. Some of them went abroad, others went to the front line to defend our country, and the number of professionals is insufficient, especially in the communities where there are IDPs. And we spoke a lot about disability today, but as I see it, we only look at those people who have the official disability status. But in Ukraine, unfortunately, a lot of people of the age category 60 plus do not document their disability and get the official status. So no donor or the state has officially calculated the number of people who need this care as of today. Next slide. So I will be brief. I wanted to emphasize just one more point, that we asked ourselves the question, why does it happen this way? Why people do not get these services if they need that? If you use Facebook, probably you've seen the message about the tragedy where the mother contacted social services, all the services, mobile teams, and was refused from the service. And her child was an adult with intellectual disability, and the mother simply killed the child. And sometimes we overlook, we do not reach the most vulnerable service user out of the vulnerable service users. It's a very, very difficult point. Besides, collecting data about men and women with disabilities is not enough. This is not very, very sufficient approach for us as for NGOs, because the number of people who need support is is getting bigger. One more example, if the veteran comes home and let's say already has some disorders, we worked with the doctors who provide care on the secondary level. So when the doctors told us that we don't just pay attention to veterans these days, we also work with the family members because the wives or the relatives cannot deal with that. So when we plan our activities, we also track what's happening and we don't take into account the group of people that is the family members of persons with disabilities. Last year, we really liked the webinar from our Japanese colleagues from the Foundation of Disability, and they told us about their approach in emergencies. I mean, MHPSS approach to help people with disabilities in emergencies. We took a lot from there. I don't say that we mastered everything, but we do our best. We conducted such trainings for our coordinators, for the specialists, local authorities to inform them about this situation. Next. When we surveyed people, we surveyed caregivers, people of the age group 60 plus, different people. So you can see the veterans, their family members, children. And what we paid attention the most was, and people emphasized these issues like stress, sleep problems, anxiety, fear, irritability. We surveyed the regions which are not daily attacked, which were considered to be more or less calm. So I said that we conducted a few surveys, and it had the positive impact on the next implementation of our project. Next. So we also have the analytical report. As I said, all the materials are available both in English and Ukrainian on the website, and not only on these regions. If you open our website, you'll see interesting information when we can say that the person can get the service. We open the document and we can see that in this huge region, the person can get the MHPSS service only in 2 hospitals, and this person needs to go multiple kilometers, and is it enough just for one time a month when the mobile team visits that person once a month? Is it enough? We also prepared such methodological recommendations for people, social workers, for the centers of administrative services about where people can go to get the services, because in most cases people don't know what the state gives them free of charge, what they can use. Since donor humanitarian funds are not unlimited, of course, we don't think about donors' resources, but the first question, Katerina, which you asked, was about resources. And we say that in Ukraine, we have the resources. I gave you the number at the very beginning, but we need to be able to use these resources rightly. And one of our tasks is to teach people to use the state national resource that is available for them. Now about the access to information, all of that is great, but our patients or our clients or those we provide care to, they don't always have access to modern gadgets or visual information. They don't always have the access to the internet. I personally was in the villages where there is no mobile connection, cellular connection, or internet connection. That's why to read something or to make an appointment to take some information from the internet, that's not always possible. So I agree with the other speaker. You always have to like wait to see all the formats of work where you enter some region. Also, we prepared information for health facilities. They are standard, how you can get the package from NHSU to expand your activity. Next slide, please.
І ще ми,
And
я сказала, провели
also,
пілотний
I
громадний
said
спеціальний,
about
дивлячись наперед, ми
the
навчали лікарів,
pilot
всі вони
projects. We
отримали
trained
сертифікати
the
ВОЗ,
doctors,
вони
and
не
all
самі
of them
навчали, в нас
received
немає
the
такої можливості,
WHO
вони є
certificate. We didn't
професійними,
train
але
them
залучили
ourselves. We don't have this
організацію, яка
capacity,
акредитована в
but
ВОЗ для того,
we
щоб
engaged
вони
the
працювали з
organization
нашими
which is
лікарями.
certified
І
by the
наша робота,
WHO
моїх
so
лікарів,
that they would
наша
train
робота
healthcare
продовжується
workers,
далі.
doctors, and
І
we continue
проект
working.
ще реалізується. Це дуже
And
добре. Ми
the project
підтримуємо ті
is
медичні
still
заклади,
being
розширяємо
implemented,
навіть
so we
в
support the
медичні
health
заклади в
facilities,
областях, де ми
and we
працюємо.
even
Дуже дякую
expand
за
their
увагу,
number in
якщо
the
буде
regions where
питання,
we work.
я на
Thank you
них
for your
відповім. Вся
questions. Feel
інформація,
free
ще
to
раз
ask them.
наголошую, є
Let me
на
highlight once
сайті
again.
Національної
You
асамблеї.
can
Вибачте,
find
я
all
вже
the
далі
information
не
on the website
просто
of the
презентацію
National
його
Assembly.
відправити, бо я перебрала
So,
трохи часу.
sorry, I overtook the time a bit. Thank you so much, Larissa. I can see that there is a question from Olena. Olena, the floor is yours.
Так, вітаю, пані Ларисо,
Yes,
дуже
hello.
дякую за
Thank you
ваш
so
доклад.
much,
Це було
Larissa,
дуже
for
цікаво.
your
Я з вами
speech. It
згодна.
was very
Про
interesting.
те, що є,
I do
скажімо, така
agree with you
проблема,
that there is the
що
problem
послуги
like that,
начебто є, але
that the
якість потрібна
services
дуже
are
велике
kind of there, but
питання.
like
Те,
there
що
is a
є
big
сама
problem and
експериментальна
question how to
ситуація,
get them. Out of my experimental
коли
activity,
начебто
there was a situation.
я людина, яка не знає про громадські
I'm a
організації,
person
але
who
хочу
doesn't
просто потрапити
know
на
anything about NGOs and simply wants to get the counseling session with psychologists. I know that in Dnipro and Dnipro region there are 130 psychologists, and I entered Helsinki and there is just one psychotherapist and one psychologist. So like it's not clear how a common person can get the service. That's what I wanted to say. Secondly, Larissa, also I was very interested by what you've said. Did you leave your contact information here? I would like to contact you. I'm Olena, MH4U
Я
coordinator.
зараз пропишу контакти, просто
I will
немає
put
часу.
my
Це
contact
питання для
information
нас
in
дуже
the chat.
болюче. Я сказала,
This
що
is
в нас
very
в
painful
організації
point for us.
входять
As I said, in our
користувачі
organization
психіатричної
we
допомоги.
have the
Кожного дня.
users of
Ми дуже знаємо гарно
psychiatric services,
ситуацію з доступом до
and
лікарів,
we
з
know the
доступу до
situation
ліків,
related
отримання
to the access to
препаратів,
doctors,
госпіталізації,
medications,
юридичний
hospitalization,
супровід. Це всі
legal
питання, з
support.
якими наша
All these
організація
points
зіштовхується
our
кожного
organizations
дня.
face
Батьки,
every
які
single
виховують
day.
дітей з інвалідністю, не
Parents
можуть
who
отримати
bring up
послуги.
children with
Ви
disabilities
знаєте,
and
у нас в
cannot
офіс
receive the
кожного
services.
тижня
You know,
приходить
every
психолог
single week a psychologist comes to
для
our
того, щоб
office
працювати з
to
колективом. І
work
коли
with
іноді
the
чую
team. And
мобільні
sometimes
бригади,
when I hear
прекрасно,
that
ми за це.
mobile
Ми
teams
навіть
work, that's
необхідне
great. We're all
документи
for
це
that. Even
залишили. Але мобільна
we
бригада один
mentioned
раз в
that
місяць
in the
не
regulatory
змінить ситуацію
document, but the visit of the
повністю.
mobile team once a
Ну, треба
month won't change
реалістично
the
підійти до
situation.
тих
You have to be
ресурсів, якими
realistic
користуємося,
about
до
the
тих
resources
ресурсів
that we
людських і
have,
фінансових,
human and
для того, щоб
financial
змінити
resources to
ситуацію.
change the
Знаєте, ну, у
situation.
нас такий
You
девіз:
know,
зайшов в
we have
громаду,
the
треба
motto,
працювати так,
when
щоб
you
кожен з
enter the
тієї
community,
громади
work
вийде,
with it in
щоб
the
вона
way
могла
that when you leave it, it will continue
стабільність
functioning.
гуманітарної
It's
допомоги,
about the
які сьогодні
sustainability
надають
of
ряд
humanitarian
Ну,
care
так
that is
давайте і надавати
provided by
стабільно.
different
Давайте
stakeholders.
поможемо
So let's
лікарні, щоб вона
sustainably
могла
provide it.
надавати
Let's help the
послуги.
hospital
Ну, якщо на
provide that service.
24 села
If
психолог в
for
школі і 3
24
сімейних лікарі,
villages there
як
is
ви
a
знали, як
psychologist
можна
in the
охопити
school
таку
and only
величезну
3 family
кількість людей?
doctors,
І
I
до
don't know how
обласного
to
центру
cover
кому
so many
60,
people with
кому
the
80
services, and
кілометрів.
for some people it's 60
Ну,
or 80
виходить, що ми,
kilometers to
ну,
get to the regional
ми багато
center.
працюємо,
So
багато
we work a
робимо,
lot,
але
we
ми
do
не
a
йдемо
lot,
до тих,
but
які
we are
потребують
not
цієї допомоги,
providing
до
the
вразливих
services
серед
to the
вразливих.
most
От чому
vulnerable in the
проблема.
vulnerable category,
Ситуація
to
в
those who
Києві не
need this
можна
care.
дивитися
Even in Kyiv,
або
even in the
послуги в
capital, you
Києві.
cannot get the service in the capital.
Це нонсенс. Тим паче в
That's
Дніпрі. Той
nonsense.
випадок, що я
Besides,
розказував, він в Дніпрі був.
in Dnipro, the case I
Мама
shared with you was in
на
Dnipro.
півтора,
The mother,
півроку.
half a year, was trying to get the
В одній
services
службі, в другій. Ніхто не
from
міг їй
different
допомогти.
organizations. No one could help
А
her.
потім, коли
How is
це,
it possible? And
виставила
then
коаліція
when the
заходів
coalition
інтелектуальним
of
порушенням
persons
відкритий
with
лист
intellectual
до
disabilities
міністра, і він був
sent the
оприлюднений на
letter,
Фейсбуці.
open
Виявляється,
letter
це
to the
не
minister, and
поодинокі
it was
сьогодні
posted on
випадки. А
Facebook.
ми
Turns out
говоримо
that it's
про
not a
розвиток
single case.
програми.
And
Прекрасно,
here we're
що ми
speaking about the
звертаємо
program
увагу.
development. It's
Прекрасно,
great that
що
we
ми
pay
вивчили
attention to
міжнародний
that. It's
досвід.
great
Він
that we learned
колосальний. Ви знаєте,
international
я
experience. It is
захоплююсь,
enormous.
бо ми працювали
Personally,
з
I admire that because
колегами з
we
Японії.
worked with
Ми
colleagues
дуже
from
цікаві
Japan, and
методики,
they have
коли
great
готуються
methodologies
громади,
where
і як
the
це все,
communities
на
unite
користь людям.
and
Треба
how all of
якось,
that benefits people.
я
So
емоційно, можливо, говорю,
maybe
але це питання
I'm
для нас
speaking
болюче
emotionally,
доводиться.
but this
Бо
is a
кожний
very
день
painful
їх все
topic for us because every single day the number
і
of
не
these
можна
people gets
надурити.
bigger and bigger,
Мабуть,
and
знаєте, треба
they're
робоча
like
група.
we cannot
Я
see the
задалась
way out.
питанням
Maybe
для
we
себе.
need the working group. And I
Хто
asked
і
the
які
question,
проекти серед
who and
донорів
what
реалізують
projects
по
among donors implements
MHPSS?
in
Я не можу знайти
MHPSS, and I cannot find this information.
конкретну організацію і
The
донор,
organization and donor
який їх
that
реалізує. І коштів
implements
скільки
these
витрачено.
projects, and it's
Тільки
not
в
clear how
державі
much money was
величезні
allocated.
суми
Only in the
коштів, які
state
повертаються в державу,
enormous
бо ми
money
їх
was
не
allocated, and it
використовуємо. Як
goes
це
back
може
into the
бути?
budget
Як це?
because we did not use it. How is it possible? I
Я
don't
залишу
get
свої
it.
контакти в
I
чаті,
will
бо з
put
нами
my
можна
contact
зв'язатися.
information in the chat. Feel
І
free to
там на сайті
contact me,
також є, мабуть,
and on
ваші
the
контакти.
website you can also see our
Дякую,
contact
дякую.
information.
Обов'язково
Thank you.
вам напишу. Дякую.
I will email you. Thank you. Thank you so much, Larissa. We know that a lot has been done, and there is like your platform is great for information exchange. From our side, we will also separately contact you to communicate where to find the information working in MHPSS, what services they provide. So as a technical working group, we will join you and support this request because we are doing our best so that the information that we collect would be accessible for other colleagues from other sectors and sectors which are related to MHPSS and adjacent to it. So thank you so much that you bring up these questions and that you implement this activity for so long, and that you don't give up fighting for justice and for getting the needs of persons with disabilities met, so that people who have different disorders and who need accessible services would get them. Thank you. Thank you, Larissa. Let's move on to our next speaker, the final presentation of the day today, but it is just as important. This is the presentation of the organization Liga Сильних. We have Alona with us, Junior Project Manager of the community organization or non-governmental organization Liga Спільних. Thank you, Alona, for joining us. So good to have you here.
Вітаю, шановні колеги. Дякую, Катерино.
Thank you, colleagues. Thank you for inviting me. It's good to be here and to represent the League of the Strong, Liga Сильних, and it's great to see familiar faces. It was so interesting to listen to the speeches today, and I hope that the participants will get the presentations.
Сподіваємося, що все вийде. Давайте спробуємо. Так, щось мені.
Можливо, зараз спробуйте.
Так, прошу.
Try right now.
Можливо, зараз спробуйте, бо я тут не дала налаштування.
Це мені мій комп'ютер не дає. Так. Якщо я хвилинку зараз ще
Just a moment.
то тоді я попрошу вас демонструвати екран.
If I can't share it from my laptop, I'll ask you to share it from yours.
О, думаю, вдасться.
It seems like everything works well.
Чи видно?
Can
Окей.
you see it well?
Так. Мене звати Альона Морозюк.
I'm Alona Morozuk. I represent the League of the Strong. Our mission, briefly, is decent life for every person with disability. I mean, we are the Association of Organizations with Disability, and we work on the level of system changes, and we advocate for the changes to legislation. We develop and strengthen local organizations, and we work on the change of attitudes in the society to disability, as our communication expert says, from like despair and to respect, from pity to respect, and to engagement. From the full-scale invasion, we started actively working in the field of humanitarian aid. From July 2023, we implement the project Empower Ukraine with the support of the international donors, European Forum on Disability, and Christian Mission of the Blind. And we implemented this project in Черкаська, Ivano-Frankivska, and Ternopilska regions. And the components of this project is something that we will talk about today. That is psychosocial support and services on mental health on the community level. I'd like to say that our direct beneficiaries are people with disabilities, but not just them. It's also IDPs from the risk groups, repatriates, veterans, the elderly people, the lonely, and the adult children from the institutions. And in the area of the development of mental health services, we've created the map of accessible mental health services, which helps people find support in their regions. That's 3 regions, and this map is available on our website. Here is the link, and you will get the presentation to see that in this map. This is the resource for referral, actually, and it shows where people can go to get mental health services in their oblasts or regions. Out of our observation and analysis of this map, it's been used actively by more than 1,000 users this year, and it works, and it shows that the referral services are very active and they need to be supported, and it's a part of our project. Also, we issued the referral guidebooks for 3 regions. We also share them with the help of our coordinators who work and bring these handbooks to our beneficiaries, and also they are on the website. And also, one more point that we're implementing from the beginning of the project, that is the training for the staff of health facilities, rehabilitation facilities, to improve their competencies in psychosocial support. In particular, this is MHGAP training. We engage the specialists who directly conduct such online trainings and offline MHGAP trainings in our regions, target regions, so that the experts, primary healthcare experts, would improve their knowledge in 3 oblasts. And this is something that we plan to continue for 2025, because there is the big need and huge gap in the regions. There is lack of specialists, and on top of that, the specialists lack knowledge. So that is something that our coordinators face in the regions and report about that. Also, briefly, I'd like to outline the mini project that, in our opinion, is one of the best practices engaging psychosocial support and humanitarian care and aid. It's 6 communications or 6 talks about resilience. We implemented this from September 2023, and it was for 1 year and a half in Ivano-Frankivsk. The beneficiaries were very different, all the groups: veterans, IDPs, persons with disabilities, and also the residents affected by shelling, and which and who have the losses. The format was peer-to-peer format where everyone could share own experience and hear somebody else. In these 6 meetings, 6 talks, the participants shared their pain, their loss, shared experience. Like these meetings formally lasted for 2 hours, but sometimes people stayed for 4 hours, 5 hours till late, and they transformed these meetings into informal talent shows or reading poems, literature evenings, and so on. It was very interesting, and it showed us that really there is the need to have these meetings, and that this is the first point, that people shared their experience with each other, but also the experts on MHPSS were engaged into these meetings in Ivano-Frankivsk, who also conducted the psychological trainings, literature discussions. There were a lot of practical exercises, art therapy. I mean, it was very helpful experience. It was very interesting, and we continue doing that. So I have a video to show what these meetings were like. I had to show you this video, but it will make more sense if each of you watch this video after the meeting. So what did these meetings give people? They felt that they are a part of the community, that they belong. Despite the differences, we've managed to unite very different categories of people in the city of Ivano-Frankivsk, and earlier they never attended similar meetings and heard about any type of such support in this region for people with disabilities. I mean, they got to know better what humanitarian aid can be provided to them, what psychological aid can be provided to them. They were ensured that they are not all alone with their problems. They created the community, and we also created a group on Telegram channel where people stay in touch with each other, and this way we ensure the sustainability of such meetings and talks. And of course, they got the safe space where they expressed difficult topics and could be understood. The only thing that we inferred from these meetings, the lesson learned, it would be great to disaggregate participants. It was difficult to get together veterans, persons with disabilities, caregivers, all of them. That was the point, that for the future we would disaggregate these groups and would have separate meetings for separate beneficiaries by categories, because like having all of them in one group, that's great, but there is the situation that we failed to engage everyone to the extent we'd like them to be engaged. At least it has to be a separate group for adults and children, or for persons with disabilities and their families, and separately for veterans of war. So we really observed that it needs to be done like that, and we shouldn't group all people in one group. Let's move on to the community, the League of the Strong. We understood that the separate projects aren't enough, and the system approach requires empowerment in the organizations, in the regions, organizations of persons with disabilities, and organizations working in different locations. To do that, we created the community of the League of the Strong. It's been working for more than 2 years. This is the very active network where every organization can follow its plan, but at the same time it can exchange experience with others and receive joint trainings. And we can see that 119 organizations of persons with disabilities all over Ukraine are a part of our network. It is getting bigger and bigger, and 65 organizations work in the area of mental health and psychosocial support. So what does the community get briefly? That is advocacy, like the unanimous voice is stronger, trainings, also access to MHPSS trainings for the organizations.
майже щомісяця ми проводимо такі
Almost
навчання.
every month we conduct
Це є
trainings like that. That is
консультації,
also
тобто у нас є,
consultations,
власне, в
because
Лізі сильних експерти,
we
які
have the
нам
experts in
можуть
the League of
надавати
the Strong
підтримку,
who can provide consultation support. So
та
also participants can get mentorship and information updates, and that's the benefits of participating in this community. And let me focus a bit on
теж на тому, що нам може бути цікаво сьогодні.
what can be interesting today. That is the services provided by the participants of our community, and actually in the area of mental health and psychosocial support. Especially, I'd like to highlight the integrated approach principle, where psychosocial support is combined with other types of aid, legal, educational, and social. For example, Caritas in Volyn region has the project Children and the War, and they combine art therapy with the craft workshops and different theater classes and work with parents. The Charity Foundation Development and Social Justice of Ukraine provides psychological and legal aid, and NGO The Mother's Heart combines social rehabilitation and inclusive camps. Also, we have bright examples of narrow specialized services. For example, NGO Psychability works with people with severe mental health disorders following case management methods. That is something that we heard from the very beginning of our meeting today. And the Center of Child Development, TDR, specializes on sensory integration and neurocorrection for children with autism, and Charity Foundation, the Dignity House, works on the institutionalization of men with disabilities in the institutions. One more important direction is the safe spaces in the communities where people can go to ask for aid. I mean, that's resilience centers of Caritas in Volyn region, inclusive centers, the strong with their spirit Сильні духом for the young people with disabilities, and the Center of Social Adaptation created by NGO Rodina, the family for persons with disabilities. So Empower Ukraine covers the whole Ukraine. As I've already said, the great tools which give a chance to work with trauma and stress, these are art tools like art therapy, music therapy, fairy tale therapy, psychodrama. And in this picture, you can see the examples of how Caritas in Volyn region work, the Charity Foundation, the development in Volyn, and the NGO Mother's Heart. And also we need to understand the high quality psychosocial support is impossible without specialists. That's why we invest into trainings. For example, NGO Parostok provides the training for support groups. Caritas Kyiv prepares social workers, and Rokada provides the training on psychological first aid to specialists. So to sum up, psychosocial support has already become the part of humanitarian aid, and a lot of organizations have practical experience in that, which is adapted to the target group needs. And it's nice to see that in the community, the League of the Strong has professional capacity, and we can see the examples of integrated, specialized, innovative approaches from case management to art therapy, safe spaces in the community. I mean, that's like about epotherapy. Also in Cherkasy region, they developed a new project on bee therapy aimed at persons with disabilities. It's a type of therapy where people integrate with the nature, and it is adapted out of the international experience practices. So we'd like to hear more about it from our colleagues developing this in Cherkasy region. Together with that, we still face some challenges that we try to work on. First of all, it's unequal access to the services in different regions. The Empower project experience has shown that it's very difficult to implement the services on MHPSS in remote regions. in remote communities because people are separated logistically, first of all, and it's so difficult for them to get any information, and it's way more difficult for them than for people living in the regional centers. It's difficult for humanitarian organizations to get there, and in general, there is a problem in these communities because they lack specialists. Not only specialists of mental health, but in general, primary health care specialists. So what we're going to do is we will continue working in every single community of our target regions so that to maximum we would reach our beneficiaries, because the need in psychosocial support is very critical and it's there in the remote areas. Also, the next challenge is the limitation of sustainability due to the short-term funding dependency, also the high workload and burnout of specialists who often work in difficult conditions. And to overcome that, we plan to continue implementing the WHO program MHGAP in the target regions, and the stigmatization of mental health disorders is the next challenge because some people do not ask for help even when it's there. And it's great that we overcome this challenge together with all the colleagues we heard today. So I'd like to say that we think that it's important to support not only separate initiatives, but also we pay a lot of attention to the development of the organizations themselves, which work with the communities, because they understand the context, they have trust, and they can ensure the presence in the areas where it's truly needed. That's why we are focusing on trainings to ensure sustainability of service provision and humanitarian aid provision in particular, and MHPSS services. Of course, it means that we want to focus on ensuring organizational capacity, as I said, providing trainings in locations in remote communities, and to create the necessary conditions for the long-term presence and intersectoral cooperation with health sector, education, and social sector. Thank you for your attention. I was brief, but I didn't want to take a lot of your time. Feel free to ask questions. I will gladly answer them. Thank you so much, Alona. I can see that there are no questions, and we took over time, but these presentations are important, and thank you for joining us, and thank you for this important activity that the League of the Strong is implementing. So it's very important. Thank you to the League of the Strong, and these points of psychosocial support and mental health are priority points for a lot of organizations. So thank you for joining us and sharing your experience and the experience of different organizations and activities of different organizations, which are also the members of our group. Right now, let's wrap up our meeting. I'll give the floor to Julia to sum up the main thesis and to wrap up the meeting. Thank you, Katarina. I want to thank all the speakers for the very informative speeches on this topic of inclusion. I want to thank Stefania for the idea how to overcome the barriers, how to ensure the efficacy of work, even in the conditions of limited funding. I want to thank Svetlana for practical tools ensuring access to services. I want to thank Heather for sharing the key elements of the information note. I want to thank Clarissa for emotional and sincere story about the pilot projects in the regions and the challenges that are still there. And I want to thank Alona for the inspiring presentation of the work of the League of the Strong, and that you highlighted the importance of the integration of different directions
послуг психічного здоров'я,
and
психосоціальної
services
підтримки
of
в
mental
секторі.
health and psychosocial
Дякую
support in
кожному з
different
вас за те, що
sectors.
були
I want to
сьогодні з
thank each and
нами,
every one of
за
you for
ваші
joining this
запитання,
meeting.
за
Thank you for your
участь і за
questions, for
щире
the
зацікавленість.
participation and
А
sincere
як і
interest.
обіцяли, протокол
As we
відеозапису
promised, the
зустрічі
protocol
та
and the
презентації
video
спікерів
recording
ви
of the
отримаєте
meeting
електронною
and
поштою
the
найближчими
presentations of the
днями.
speakers will be sent to
Дякуємо вам за
your
цей
email
спільний простір.
in
Нехай
the
цей
next few
день
days.
буде
Thank you
спокійним,
for being here.
теплим,
We wish you to have the nice,
До нових
warm,
зустрічей.
inspiring day and see you soon.
Дякуємо.
Thank you.
Дякую, до побачення.
Thank you. Goodbye.
Гарного дня.
Дякую. Можна запитання? Я трошечки запізнилася.
Sorry, a
Куди ви
question.
вишлете? На яку електронну пошту?
To what email will you send it to?
А туди, куди ви
To the
отримали
email where you
запрошення
received
на
the
цю
invitation
зустріч.
to
Якщо ви
this
не
meeting.
отримували
If you
запрошення,
didn't get
ви
the
можете
invitation to
перейти
this meeting, please
на сайт
open the website of the technical working group, and over there you will have a chance
зробити запит на підписку.
to
Зараз
request
я ще раз
the
Я
subscription.
зайшла через,
So I opened
через
what
канал WhatsApp.
via WhatsApp channel.
Добре, дивіться, зараз я
Okay,
в
so
чаті продублювала
right now in the chat,
посилання на
I
сайт.
put the link to the website.
Якщо ви перейдете по цьому посиланню, там є
If you follow the
такий
link,
розділ,
over
там
there
написано
there is
«Підпишіться на нашу
a
розсилку».
button subscribe for our
Можете туди нажати,
newsletters.
заповнити форму,
You can
і
fill in the form and
вам буде надходити
you will
посилання.
get the newsletters and all the recordings and the minutes of the meeting.
Не можу я зайти на ваше посилання.
For some reason, I cannot open your
Тоді,
link.
якщо вам буде зручно, ви
Then
можете залишити свої
You can
контакти
leave
в
your
чаті,
contact
і
information
також
in the
ви
chat,
будете в
and you will
списку
also
розсилки.
be added to the
Якщо
newsletter
ви
list.
залишали свої контакти вже в чаті,
Did you leave your
дублювати не
contact
треба. Якщо ні,
information in
то
the chat?
Я не
If
можу зайти
so,
в сам чат.
no need to
Щось
duplicate this
заглючив мене
information. I
телефон.
cannot
А
open
якщо я
chat.
залишу свої
What if
контакти
I
в групі
give
WhatsApp,
my
мене там
contacts in the
зможуть
WhatsApp group?
сконтактувати чи ні?
Will it help you?
Або давайте зробимо
Or let's do it this way.
таким чином. Я вам зараз залишу свої контакти.
I left my contact information
Або
in the
навіть не
chat.
свої. Дивіться, зараз я вам залишу контакти технічної робочої групи
I
електронної
will leave
пошти. Ви
the
можете
email
туди
of
написати,
the
ви в чаті
technical
бачите.
working group. Do you see this
Зараз
information in the chat?
О, тепер бачу.
Now I
Тепер
can
мені
see the
повністю відкрився
information in
чат,
the
де мені
chat. Now I
нажати
can
на це
see the
посилання,
chat, so
де
I
ви
have to
перше,
follow the link, the first link, right?
вислали.
That you sent.
Там є
Yes.
посилання. Тут я вже бачу вашу пошту.
I already
Ні, не
can
вашу.
see. Oh, it's somebody else's
Щось
email.
іншу. І останнє повідомлення, там
And
бачите,
the last
є електронна адреса.
Message is the email. You
технічної
can
робочої
see there
групи.
of
Ви
the
можете, якщо
technical
у вас не
working
виходить
group.
зареєструвати,
So if you cannot
надіслати запит на
send the
додання на
request
розсилку
and
через сайт, ви можете написати на
via
цю
the
електронну
website, if you
пошту,
can
вам
subscribe via the
допоможуть.
website, feel free to
Давайте я,
email
може, просто зараз скину свою електронну пошту, будь
and
ласка,
you
якщо
will
можна.
be supported.
Хвилинку
Or
почекати.
I can send you my email.
Дуже дякую вам
Thank you so much.
Прошу.
за терпіння, за чекання.
Вибачаюся, що це викликало такі складнощі
Sorry
у
for
вас,
any
але
inconveniences.
додамо вас також у розсилку. Дякую, гарного вам вечора.
Yeah.
Thank you. We will add you to the newsletters. Have a nice evening.